Morning rounds today, Tuesday. We're going to talk about long-term effects. Long-term effects of both COVID and vaccine. So it gets right into, okay, well, which one do we know the most about? The ultimate answer is neither. Because when you hear, I had a conversation with my aunt last night. Well, text, can't say conversation. So, question was on long-term effects, was one of the things. And it's a big thing that people think about because people are like, well, we don't know the long-term effects of the vaccine, so I'm not going to get it. As a point to it. But then you look at what's the counterpoint to that is what are the long-term effects from COVID. So you can't just compare yourself on one point of, okay, well, we don't know the long term on this when you don't know the long term of the other side, because it's a mute argument, because either pretty much you're going to get the vaccine, or you've either had COVID already or you're going to get it at some point. It's not going to go away. So even though we're getting better here in America at this point, you're still going to get it. And then you have to get into what's the options. What do we know? What do we know? What don't we know? What are the long-term effects of the vaccine? That we don't know. But we do know some long-term effects of COVID because it's been around for a year and a half now. And that's apparent in a lot of people. If you know somebody in your family that's had COVID, ask them if they're having any long-term effects. And majority of people that I know that I've seen, that I've interacted with, patients of mine that have had it, they're like, yeah, I still have a little bit of this, still have a little bit of, chest weird discomfort, or I get a little short of breath if I do this or that, or it may be something else just odd, fatigue, headaches, joint pains, anything like that. So that's just symptomatic things people feel. But then you get into some of the other effects that are actually proven lasting effects that are permanent. And that gets into, okay, well, if you have a CT scan when you go into the hospital, if you had to go to the hospital, those findings they see on those scans, depending on if it's fluid or if it's scarring, the scarring can develop very rapidly, which is strange in the condition. That scarring in the lungs doesn't heal. It's the worst healing part of the body, really. So when you get something in your lungs that's scarred down, it's permanent. To heal a little bit, your body will adapt to it. Those changes are usually permanent. And that's long term. That's as long term as you get. There's been some MRI studies that have shown changes in young people with mild to moderate cases in their hearts. Literally tissue around the heart, in the heart, being abnormal after mild cases of COVID in a significant amount of people, young, healthy people, that we don't know what that is long term. But we're seeing changes. We know that can happen. So lung changes, heart changes, then you look, and that's the biggest, most obvious ones that you see, the most frequent, I would say. People just not getting their stamina back, the endurance back. They're fighting to just feel normal again. And that goes on for a long time. And then you talk to people that have had the vaccine, they may say, okay, well, I felt terrible for a week, or I had 2 days. Usually it's like 2 to 3 days, the ones that feel bad. But then that's your typical response. That's your expected response. Okay, well, you're going to go ahead and hang it up that you're going to feel bad for a couple days. Some people won't, but usually you're going to feel something. And then, okay, well, that's expected. What about the ones that get more than that? The ones that get the lasting joint pains that just won't go away. The just fatigue, or the head fogginess, or the little stuff. It sounds little, but it's annoying. And you wonder, why doesn't it go away? We don't know those answers either. We know that it can cause, the inflammatory response can attack odd places. And the joints do seem to be a place where we're seeing that. Even I feel like I have weird I would say pain or stretching, when I stretch small muscle fibers, tendons in like my hands, thumbs, I feel like it's different. And I had my vaccine a while ago, probably, I don't know, 2 months-ish, maybe more than that. So I can still feel that. That hasn't gone away for me. Almost like if I pick up a bag and my fingers pulled down a little bit, normally couldn't feel anything. Now it's almost like a stretch sensation. It's a little painful, but that's different. So I have little things like that. And you wonder, what is that? So the answer to the question of long-term effects is we really don't know. There can be some effects from both, I believe. I think there's more prevalence of longer-term worse side effects that we've seen when you actually get COVID. You have even a moderate case, even some people with mild cases. So those lasting effects are there. The vaccine stuff is still unknown. So that's why I was saying yesterday, it's a gamble. But you're going to have likely, majority of people have nothing. So if you're the unlucky ones that get something, you're playing with the odds. And there's no strategic breakdown to what percentage of people are getting long-term effects from, from COVID or from the vaccine. Nothing that I've been able to find to actually compare those things. So you kind of have to see what's out there, talk to people, ask people, what were your effects from this vaccine or that vaccine? I think they're all pretty relatively similar with vaccines. And then risks, the clotting issue. I've talked about that. The clotting issue is 10 to 20 times more prevalent if you get COVID than it is with your adenovirus vectors like AstraZeneca and Johnson & Johnson. So again, risk. Way more risky to do one than the other, statistically speaking, but you gotta keep that stuff in mind. It's never gonna be zero. Like, well, I just don't want to do anything. I'm just gonna wait. Well, then you're probably gonna get COVID if you haven't already had it. And then you're gonna have those risks. So you can't compare the risks of a vaccine to nothing, because nothing's probably not the answer of the other option, because nothing would turn into COVID if you don't get the vaccine, because in a pandemic it doesn't stop until everyone's basically either been vaccinated or has been infected, or a vast majority with herd immunity. And then the risk is still there. It can still happen, especially if you don't have a vaccine. So you can't say one thing or the other. It's a tough call, but I think it's a valid point, and everyone likes to bring that up on both sides. Long-term this, long-term that. But at the end of the day, the long-term risk is on both sides. And unfortunately, past 6 months for the vaccine, and really past a year and a half for COVID, that's as long-term as we have. So you can't make up long-term data if you don't have it. It may shift. There may be a worse effect down the road from one or the other. We don't know that. But to say you do know that, if anyone says they do know something, they don't know. So, because it's impossible. You can't predict what will happen because of a vaccine, or because of a technology in a vaccine, mRNA, or the whatever you want to say. It's all theoretical. So theoretical cherry picking doesn't turn into science. That's usually, I would say, 99%. That's me making something up, but wrong. So use your best judgment and stay safe. See ya.